Good evening, ladies and gentlemen, and welcome to yet another very interesting topic in regards to intellectual disabilities. I remember my humble self, Lucky, Dr. Drugs. Now, if we're looking at this screen, we see that we're talking about applied behavioral analysis. You're asking, what's applied behavioral analysis? This is one of the key factors that are involved. And we're going to see another very key factor before we comment, before we go deeper into what we're talking about. So let's just have a recap about one or two things that have to do with autism. And remember, humble self, drugs. Our table of content is very simple. We'll talk about autism and ADHD. Then we'll talk about speech impairment, because we need to understand what speech impairment is before we begin to talk about applied behavioral analysis. So I'm just going to give a summary. I'm just going to give a summary of applied behavioral analysis. And of course, we know that autism is simply known as a neurological and developmental disorder that affects communication, social interaction, and behavior. And of course, it's a silent epidemic. Now, autism spectrum disorder, in a broader sense, is a developmental condition of variable severity. That means some children may have it worse or better than others, significantly affecting verbal and non-verbal communication and social interaction, restricted or repeated patterns of thoughts and behavior. That's a broader definition. Of course, we know that it's a spectrum disorder and it can present itself differently in different people. I keep saying once in a while that we have some politicians, top people in government, people in various parts of the world and country that hold or are very popular that are actually autistic. And of course, we should also bear in mind that a lot of children that are autistic are geniuses that are actually trapped in themselves. We're going to find out why shortly. Of course, various stressors and of course ambient conditions can actually provoke or manifest signs of what we call ASD. We already know that it's in tandem with the neurodiversity or behavioral and or characteristic differences of human species. And let's not say we're trying to cure a child that is having ASD or ADHD or other intellectual disabilities that are related to that. And let us also accommodate them with love. And of course, we have different types. As you can see, we have the classical autism, the Rett syndrome, that is mostly in females and starts from 6 to 18 months. I've noticed a pattern that around the age of 1 and 2, some children that actually were developing normally just get struck by this condition. I've noticed that it's very, very common and very, very rampant. I don't know why it happens within that age, but you can see that Rett syndrome is particularly within that age. Then we have Asperger's syndrome, then childhood disintegrative disorder, CDD or Heller syndrome, and of course, pervasive developmental disorder, not otherwise specified, is a milder form, but of course, some symptoms of autism and so on and so forth. These are the basic signs. We know that it has to do with difficulty in social interaction, verbal and non-verbal communication issues. Then, of course, perseverative interest, stereotypic body movements, rigid routines, over and under sensitivity, as well as restricted interest. Risk factors, just a quick rundown. Older parents, certain prescribed drugs, then things that happen before pregnancy. We talked about that before, like women that smoke and drink, expose themselves to all sorts of solvents. Please, let's bear in mind that people that are exposed to certain solvents like paint solvents have a 50% chance of having a child that has autism. I know we may have not heard this. A lot of us may have not heard this before. That's why you see some people that are actually dealing in cosmetics, makeup, and mixing paint and using all sorts of solvents and all that. I have a very high risk of having children that have autism. I posted this on our special group not too long ago, where I even showed us where we can go to on Google to see the research live. I posted that for people to see, and some people were actually screaming and surprised and calling. I'm like, what? I'm like, yes. You go and check around, you find out that a lot of people that have children that have autism are often people that cannot do without application of makeup. Go and verify. You see that they're always applying lipstick, always spraying all sorts of things all over the body, hairspray, body spray, and all that. You can see that. Now, of course, things that happen during pregnancy are not left out, and things that happen after birth are not, or even during birth as well, are not left out. Of course, environmental factors like air pollution, cause hostility and shock and all that. Especially children that witness broken homes, when homes are breaking, where husband and wife are fighting physically, and the child may have a bit of trauma or a bump as the parents are scuffling and all that, and that can rattle the brain in the skull and can provoke all sorts of things, including autism, of course. Then, of course, environmental factors are not left out. Then, of course, air pollution, we just talked about that. Chemical substances, yes, heavy metals. You should be very wary of that, like the ones found in some paints and all that, some dyes. You see those things in the lipstick and all those, some of these lipsticks and some of these ice creams and all these that contain all these kind of dyes like tetrazine yellow and sunset yellow and all those kind of dyes, red dyes and all that can actually provoke autism, of course. Then preterm birth is not left out. Genetics, being a male, poor brain development, you see, is highlighted. That's one of the major challenges with regards to autism. Small birth weight, delayed delivery, malnourishment, of course. And of course, we know that it was previously known to occur one in 100 people worldwide. But America, for an unknown reason, seems to be topping the charts one way or the other. As of course, not even an unknown reason. We know they love a lot of snacks, a lot of refined carbohydrates and all that, and they are having more children that are being autistic. In fact, America is slowly turning out to be the world capital of autism because of the way they love taking sweet things and a lot of other things like that. So it's not, and of course, the amount of chemicals that they are pumping into the system, people all dyes and all that, and the culture or the way of life in America is a typical example of why children are beginning to have autism more and more these days. Let's not forget fluoride, which is very poisonous and actually very terrible, because autistic children actually swallow this toothpaste that contains fluoride and it causes fluorosis and other issues in the brain. Of course, these are not going to be advertised, but let us bear that in mind, that fluoride is a very terrible thing in regards to children that have ASD. Of course, we talk about the complications that range all the way from education to or learning issues down to bullying. Yes, bullying is another very serious issue because the autistic child cannot even express who bullied him or her, and they can get picked on and all that. I heard of a woman that was called that the child was unconscious in the classroom, and everybody just left the child there, and she just came there and just carried that child and went home because, of course, the child was not able to say what happened. When the child woke up, life goes on. So we have to be very, very careful. And there are 3 levels of autism based on independence and how much support is needed. Yes, level 1, 2, 3. Autism and ADHD are very, very related. In fact, you find out that about 30 to 70% of individuals with autism also have ADHD, and about 20 to 50% of individuals with ADHD also have ASD. Now, these conditions can actually affect attention span and communication. And of course, they are separate neurodevelopmental disorders, but they actually can share common symptoms. As you can see here, a very distinct way we can actually differentiate them is that you see that ASD is primarily characterized by social communication difficulties, restricted and repetitive patterns of behavior. Then ADHD has a lot to do with inattention, hyperactivity, and impulsivity. That's a very simple way to differentiate both of them. Of course, they share similarities, of course, that have to do with difficulty with social interaction and communication, repetitive behavior, and so on and so forth. These are the comorbidities or the ASHB of ASD. You can see from epilepsy all the way down to self-harm. This is how it's managed. I keep emphasizing that the mother is the first doctor after God, period, because her knowledge of this condition and how to manage it is key in the management of these conditions. Then, of course, improved neural connectivity and neuroplasticity is not left out. We're going to delve deeper into that. We're going to talk about ABA and the importance. But before then, there's something important I want to share with us. And of course, let's not forget that we have to avoid chemical substances mostly. And of course, early management via applied behavioral analysis. That's why this topic today is very, very important. We're going to talk more about it later, but we're going to just give a summary of it shortly. Occupational therapy speech and language therapy, dieting, of course, long-term gluten and casein-free diet, less sugars. Then natural pharmaceuticals are amazing to help to mitigate the negative consequences of comorbidities and effects of this health situation by helping with proper neural connections, which is key in brain development. We talked about this a lot before. You see, before we can go into ABBA, let us briefly talk about where we are in quotes ABBAing to. Let me just put it that way. You understand? So you see, you can't talk about ABBA without talking about the brain. And there's a very unique part of the brain over here called the Broca's area. You can see that. And that part controls speech. So if anything happens to that area, a child will not be able to process thought into speech. And of course, the Broca's area located in the left hemisphere in most right-handed people. Like I'm left-handed, that means it will most likely be located in my right side. And it's associated with speech production and articulation. Our ability to articulate ideas as well as use of words accurately in spoken and written language has been attributed to this crucial area. That means a lot of people that are busy doing therapy, when the Broca's area is not proper, is not well developed, are most likely wasting their time. That is just the truth. Because the only way a child can learn or imbibe or adapt to the environment is via improved neural connectivity and or neuroplasticity. So when you hear people saying that they're drinking one agbo or herb, they're taking one thing or the other, or they're taking a child to one special school or the other, if that part of the brain is not developed, that child will never speak. I stand to be corrected. If you know anybody that feels he knows better, please come and correct me. I'll learn. But from little I know, it will never work. So one has to focus on developing the nerves that are in there and preventing the things that can provoke them to get worse with regards to improved neural connectivity and neuroplasticity. That is just basically what it is. And let's bear in mind that nerves grow or recover relatively slowly. This means that in order to assist this part of the brain to recover or grow or improve its nerve or neural connectivity, one must be really patient. There is no magical way you can resolve ASD. I keep telling parents, some people say, oh, there's one drug or the other. We're going to call out some names when we're having an interactive session, because that part can be cut off from social media. So let's just open our minds and discuss certain things. We're going to open the group. People will talk and say their mind, tell us their experiences. You know, let us share and let us see. Let me see where some people tell us that they have been taking all sorts of things and their children are not getting better. It's because people are taking things that anybody can take because they drew a child's picture in front and the child is smiling. That means the child had autism before and is now well. No, that is not how it is. We'll talk about that shortly. And let us bear in mind that the earlier, the better. You can see this amazing brain here, lifting weights to get itself improved. Now, management when the chips are down is possible because the human brain is malleable, adaptable, or changeable. And this changeability, in quotes, is inversely proportional to age. That means the older one gets, the slower the brain adapts or changes. I tell parents, stop wasting your time. Some people are going from one hospital to another. They will tell them, let's just wait a little to see whether the child will talk, maybe delayed speaking. What is that? If a child is not speaking at the time the child is supposed to speak, begin to treat that child as if the child is having ASD. Because the earlier, the better. What if after you wait for like 2-3 years and the child does not speak? You go back and meet that doctor will not even be there in that hospital, most likely. He has gone to another place, maybe even in UK or US. Whereas your child is at home not speaking, and the person that told you to stay, to give the child follow, has gone. So we have to apply wisdom when we are doing things like this. Once you see that the child is not talking, begin to do something about it. Withdraw the things that are supposed to be withdrawn and give the things that are supposed to be given. After all, none of these things affect the child negatively. So why are we waiting? You understand? And that's one of the key problems we're having, because a lot of health professionals do not even know what autism is. And we just believe that because we are wearing lab coats, we are supermen, we know everything. No, apply wisdom and allow these children have the opportunity to have a better life. That's my humble opinion. I stand to be corrected. Of course, Now, generally, the earlier the required changes are made, the better in relation to intellectual disabilities like autism. This simply means that the brain is easier to reform when the child is younger, and once again, earlier, the better. So when a child is 2.5, if autism strikes a child when the child is around the age of 2, at least between the age of 2 and 4, if you do the right things, the child should be back to at least 80 to 90%. Let me put it down. But the target is this. Bear in mind that if that child, the closer the child gets to the age of 6, the more difficult it is, because the foundation of a child's neural pathway, that is the traffic of nerves, the foundation gets laid down around the age of 6. It's just like people building carelessly in an area, and then when the government comes and wants to make straight roads, they have to demolish more buildings. It becomes more difficult. But if you lay that foundation early, the town planning committee comes around, you find out that the roads can be laid down before the buildings, and the town will be more organized. And that's how nerves will be more organized when you lay the foundation the appropriate way, early, or resolve the problem early. Now you can see that the brain can only change via improved neural connectivity and neuroplasticity. And how can this be achieved? Experience, that's over there, applied behavioral analysis. But let's not forget that another very important aspect that even supersedes applied behavioral analysis is nourishment. And that can also, because the brain needs nourishment for the nerves to be able to reconnect. That is just the truth. For them to be able to reconnect and interact, you can't imagine that the nerves are going to begin to improve or increase the synapses or begin to increase their dendrites and connect to each other when they don't even have things like cobalamin analogs or folate analogs or pyridoxine, or you find them not having things that are necessary to, or EPA and DHA, which is very, very important in brain development. So you see, that's why it's also very important. And these things are best achieved with natural pharmaceuticals. We talked about that before. Ladies and gentlemen, we have landed. Applied behavioral analysis. This is going to be a very brief and summary of what it is. You see, applied behavioral analysis is a scientific approach to understanding and changing behavior. It involves the use of techniques based on the principles of behavior analysis to increase desired behaviors and reduce or suppress problem behaviors. Applied behavioral analysis, or ABA, is often used in the treatment of autism spectrum disorder, as well as other developmental disabilities and mental health conditions. You can see the picture at the bottom left there. You see a therapist trying to apply this to someone. As you can also see, this other therapist as well, giving what I'll call prompting or cues to the child over there to help to achieve this. So this is what I just basically call the 10 commandments of ABBA. So we're just going to break this briefly. Some other time we're going to go into deeper detail of what this actually is. Now, there's some key components of ABBA, and that includes functional analysis. This means we're trying to identify the underlying cause of problem or behavior. Sometimes it could be a stimulus or an irritant or something that is actually triggering the child, and somehow we have to actually find out what it is that is the underlying cause. Sometimes it could be malnourishment. Sometimes it could be poor nourishment. That means they're giving the wrong kind of things. A child that is drinking Coke 24/7, nobody is going to advertise Coca-Cola or Fanta and tell you that it provokes ADHD. It's not possible, because these companies are open for profit. It's now left for you to apply wisdom and be able to identify what is causing that problem. Okay? Now, goal setting is very important because it helps us to specify desired behaviors to increase or decrease. You observe the child and you begin to note, maybe the child watched the cartoon, and in the cartoon, another character was smacked in the back of the head. And you see the child beginning to smack the teddy bear, smack the dolls, smack his toys, and then you leave the child? No. You begin to try to correct that before the child smacks his siblings, or smacks you. So that's a goal. No, this child is actually behaving wrongly. You have to be able to identify that there's something going wrong here. Or you find out that all of a sudden the child decides that he's going to be waking up around 10 a.m. 10 p.m. to go and watch TV when everybody's sleeping, and you hear the door opening and you keep quiet. Once the child begins to get too used to that, you find out that perseverativeness will not allow that child want to disconnect from that behavior. So what do? That your goal will be, once around 9:30, you better stand guard. So if the child is coming and say, go back to bed, and the child begins to adjust. That is why goal setting is very, very important. Assessment involves evaluating behavior through observation and data collection. I just mentioned something close to that. But the additional part is data collection. You hear some mothers, when I ask them, they'll say, this thing just started. Anytime he used to like corn before, all of a sudden, because we bought yellow corn instead of white corn, he has stopped eating. That's very good observation. That means since it is harmless, giving the child the white corn, you go back to white corn so that the child, because maybe white corn, of course, we know does not contain gluten, and of course, you can see that it can be helpful with regards to nourishment. But remember that even as much as we're looking at carbohydrate sources that do not contain gluten, like corn and oats and the rest, do not forget that they all are converted to glucose in the end, and glucose is inflammatory in the gut and can lead to leaky gut that allows things to pass through the gut, the intestine, and go to where the brain, and can lead to inflammation and other reactions that can provoke or worsen autism and other comorbidities. That's just on the side, talked about before. Now, intervention, we have to implement strategies to change behavior. Remember that when we are observing the kind of character or behavior that we do not like, let us begin to plan how to resolve it. It's not by shouting and like a lady that complained that the mother is beating her children. It's that beating the children that are autistic. That is not how to go about it. You understand? You see, that is not a proper implementation or strategy to resolve this condition. Because of course, you see that the children you are beating may not even know why you are beating them. All they know that they're just being beaten. And remember that they are hypersensitive. That means if you smack yourself like this, you don't feel much. You can smack an autistic child like this, and it will seem as if you just carried a very big stick and hit that child over there, because they are hypersensitive in some cases. So we have to be very careful, and of course apply wisdom when we try to apply or implement change strategies to change behavior. We can use a reward system to promote, and we can use a denial system. When the child does something that is wrong, he doesn't get a reward, and you see the child begins to try to do what is right to get a reward. It's possible to use that to actually change behavior. Evaluation, monitoring progress and adjusting interventions as needed. I just gave an example of that before, just not too long ago, and you can see that as the child is improving, and we see that you have to also be improving, or as the child is changing for the better, you should also be changing your strategy for the better. Because when you achieve a milestone, you don't stop there. You have to set another goal or milestone to achieve, and that's how you see we pull these children out of this condition. Now, other techniques may actually improve. Of course, you see, I just mentioned that positive reinforcement. That's rewarding desired behavior. Prompting, providing cues to encourage desired behaviors. You can see that as when a child is about to say good morning, say good, and you say, go on, good, say good morning. And you see the child says good morning, and everybody claps for the child. Hey, good job, good job. The child feels good about it. The next morning, you may be surprised the child will come and stand by your door and say, Daddy, good morning. And you say, yes, you've achieved something. That's achieved that by prompting. Then changing involves breaking down a desired goal into smaller pieces in such a way that we can, for instance, if you want a child to actually, let's say, go and boil water, for instance, and the process involves picking up the kettle, going to the tap to fetch the water, or if it's an electric kettle, put it under the tap, then you place it on the socket or the plate where you place the electric kettle, you turn on the switch, you wait there. When it gets boiled, switch it off. You see, there are about 5 or 6 stages there. For a child that is actually, just coming out of ASD, the child may forget and take the empty kettle and put on the pad where the current is supplied to the kettle to boil the water. Now, you can break this process into about 5 stages. Begin to teach the child how to fill up the kettle first. When the child learns that, you now teach the child how to carry the kettle to the pad where you put it, and you teach the child how to place it properly. Then you begin to teach the child how to wait for it to get boiled, to know when the water is boiled, and so on and so forth. You've broken it into different parts, and one day you see the child will seamlessly go through this process, and that's how chaining works. Then shaping is not left out, because you can gradually build desired behaviors through reinforcement. It's linked to other things we talked about. Then extinction, ignoring or withholding reinforcement for problem behaviors. I just mentioned not giving reward for behaviors that we do not want, and instinctively the child begins to suppress that. And so this is just a summary of ABBA technique, which is idiosyncratic and tailored to each child uniquely. No two children are the same, and that's why it's very important we have specialists involved in this. So that's just it. So these are just the importance of natural pharmaceuticals. We know that they supply fatty acids or brain food, because we can't talk about ABBA without improved neural connectivity or neuroplasticity. Of course, they help to boost immunity, manage cardiovascular issues. That's in cases of special cases. Then they help to improve thyroid function, prevent and manage dental issues, and so on and so forth. Well, usually I just show, just to give an example. I'm not saying that whatever products you see are not necessarily, it's not compulsory you must use those products, but if you're my patient, this is what I'm going to give you. The people that I have had successes with, this is what I gave to them, and their children are beginning to pull out of this. If you look here, each and everything here you see on the screen has a purpose, and they are all very, very crucial or important one way or the other. You can see that there's a blossom pepper tea up there. It actually contains chamomile. That's for children that are displaying excessive ADHD. You have the immune blend. The name spells itself out. The fiber will help with the gastrointestinal issues that are often common with ASD. We have the cardio health, contains coenzyme Q10, which is good for learning. This is original EP and DHA. That is Actic C. We have the bright tooth gel that is non-fluoride toothpaste. People have been asking me, what is non-fluoride toothpaste? That is an example of non-fluoride toothpaste. And of course, I give my patient that a lot, my special children that a lot. Then we have substitutes. These ones are substitute. This is substitute for milk. It doesn't contain casein. This is just a substitute for, although chocolate has no problem with ASD, but of course, just to improve flavor and avoid monotony, you can see that that's the chocolate flavor over there. Then of course we have this cream here is very, very, very important for cuts, because we don't want to be adding iodine, which is a free radical, into the injury, and then it's not going to the bloodstream. Remember that ASD patients are often very sensitive. Of course, we have kids, I don't know how, but this seems to provoke children to speak as well, as in combination with other stuff here. Remember that these children are not taking calcium through milk, so we have to give nature mean. Then of course, powerful probiotics is not left out, that's active group B. Then cobalamin and folate analogs, remember what they do in regards to helping the cells in the brain, to the nerve cells in the brain to regenerate and rejuvenate. A layman depiction of the brain is a ball of nerves floating in fat. Then we have this aloe spray that is also very crucial with regards to injury. These are the things we use for children that have ASD. You don't expose them to chemicals, because the injury is just open. That is, blood vessels are just naked, and you're just applying iodine and the spirit and all sorts of things are just going straight into the bloodstream to where? Brain. Then we have royal jelly. This contains choline, which of course is a precursor to acetylcholine, which is a very abundant neurotransmitter in the brain that can help the nerve cells in the brain to communicate with each other better. You can see. Then this amazing bottle here, as you can see at the bottom of the screen here, contains what is called a somatic stem cell stimulant. Please, those people that point something in their back of their tongue and saying that they're swallowing stem cell, it is fake. One, the cells that line the sublingual area in your mouth will not allow cells to pass through them. Those epithelial cells are tightly locked, will not allow cells to pass through them, so cells will not pass through cells. Secondly, if anyone escapes into your stomach, the hydrochloric acid there will destroy it. So please and please tell you that they're giving you stem cell for this and that. It is wrong. What they may be giving to you may be very powerful antioxidants. Of course, we know that berries contain active oxidants, but you cannot have pluripotent stem cells. What we have are somatic stem cells that are nature, God-given ministry of works positioned everywhere in our bodies to help us repair and replace damaged parts of our bodies. That's what we have. So somatic stem cell stimulants are what you can give. And of course, we have somatic stem cells in the brain. That means if the Broca's area is damaged, you can stimulate these somatic stem cells there to begin to repair that Broca's area. And that is why this one in that bottle is very, very, very important. So I'm going to leave us with this briefly. And I'll say you are what you consume, and there's a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on the winning side. And of course, let us remember to consult with a healthcare professional or registered dietitian to determine the best dietary approach for specific needs. Additionally, consider consulting a health professional before making significant changes to diet and other things that have to do with special children. I'll say thank you so much, guys, for listening.